All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. These exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Hello, and thank you for listening to the GynoCast. My name is Dr. Eric Heegaard. It's so nice to have everyone back listening again.
Indeed.
I'm here with my co-host, Twila Dang, my
Hello.
boss, my friend, my wing person,
You can call me a wing woman. It's okay.
wing woman.
Yeah.
And we are talking about, actually, a topic that is very fascinating, very topical, and that is we're talking about feminine hygiene, which you cannot go anywhere without seeing tons of advertisements, and we are bombarded left and right about our vaginas, if we have them. And so we're going to talk a little bit about the topic of feminine hygiene, and my special guest today is Dr. Shannon Klingman. She is a board-certified OBGYN, and she's devoted quite a few number of years really investigating the underlying kind of fundamentals of odor.
Yeah.
Of vaginal odor. So,
Yes.
Dr. Klingman, thank you for joining us.
Thanks for
you.
coming.
Thank you very much for having me. I'm so glad to be here.
So, this is a topic that a lot of times people don't talk about a lot,
Mm-hmm.
but has been something that's been in the news more and more recently, but has also become more of a topic over the last century. And now I just got to ask you guys,
Okay.
Yes.
Dr. Klingman
Yes.
and Ms. Dang,
Yes.
have you ever read the Outlander series
Yeah.
by Diana Gabaldon?
Well, okay, I'll admit, I started, then the TV show started, so I just watched the TV show.
Twyla.
Look, you
have
know
you,
I
have
have
you read it?
I pretty much spend my life in a 300 square foot space with that working on this product. I don't see the light of day too often, so this is the first time I've gotten out
Oh
in
my
6
goodness!
weeks. Yeah.
So I can tell you that pretty much anybody who's, most people, the Pulse have
Mm-hmm.
heard of the Outlander series, written by
I've heard of it.
Diana Gabaldon, I think is. And these books, she's got like 25 books, are all like 5,000 pages long. It's just they're incredibly huge books. But the reason I bring this up in the topic of feminine hygiene, there is going to be a connection here, which is the characters live in the 1700s. And she talks very vividly about just hygiene there and how people, if they bathed at all, bathed very infrequently.
Right.
And so you can imagine that people were perhaps a little bit gamey.
Gamey is a good word. Goat, beef stew,
Gamey.
onions. Yes.
Gamey, yeah. Can you imagine people? But the reality is that your sense of what is normal changes, and so I assume that if you were hanging around people who never bathed, you'd probably think it was fine.
Right.
I'm sure the cave people never said, "Hey, boy, you got to jump in that stream."
It was called pheromones.
Yeah.
was
so
necessary.
Twyla, this is the greatest thing. Is
Okay.
that in the Outlander series, right? The main character's name is Jamie Fraser Mackenzie.
Okay, here comes the accent.
Yeah, and he is this strapping 6'3", red-haired.
I told you I watched the
looks
show.
like
we
you.
know.
Okay, so you know what I'm talking about. But anyway,
Yeah.
but they are in the books. They are always talking about smells, and he's talking, and it is really interesting. And so, when did smells become bad, Dr. Kling?
Well, I couldn't. I'm sure smells have always been bad. A bad smell when you smell it, right? But it was tolerated, right? So there's some thought about what are you tolerating today. And as a society, we really have developed the problem of body odor. But here in the United States, we're pretty fastidious about our hygiene, and I think we're far enough along the path where you're not going to convince too many people that bathing is not the norm. But I will say this, that back in the late 1800s, there was a company called Lysol.
Well, it still exists, doesn't it?
It still
Yeah,
exists.
we know Lysol.
Yes,
It's somewhere in my
Lysol.
house today.
That you had under your kitchen cabinet that you used to wash your kitchen floors. And some genius leader in that company decided that it would be a good idea for women to consider beginning to use this for feminine odor and douching with it.
But let me
Yay.
step back. But why was that a problem, I guess? When did it become a problem that needed to be solved? And so we're not talking about the mid-1800s, right?
Right.
And so people have been having odor. We all have odor under our arms and different parts of our body and our undercarriages.
Undercarriages, man.
And when did that become something that, as in Outlander series, Jamie Mackenzie Fraser, when his wife would walk in the room, his nostrils would flare like one of those bull mooses that come out of the forest, and they.
In a good way, or
in
was
a good
he,
way?
in
No,
a good
he was
way?
he was breathing, and she talks about his musky male kind of.
Well, I mean, we already, I think we've well established on this podcast that I have a thing about smell.
I know you like
Good, or
Mr.
you like smell?
Dang.
Yeah, I like
Mr.
how
Dang
men
smells like.
smell. And I like how, that's my only celebrity question. When people meet a celebrity, I always ask what they smell like.
Yeah.
I have a thing about that.
How close do you have to be?
What, to know what they smell like?
Yeah.
Oh, you have to at least stand next to them to take a picture or hug them or something. I mean, if you can smell them from a distance, that's a problem. I've heard about a couple celebrities like that. That's not good.
Yeah, Johnny Depp.
I'm not saying any names because nobody's suing me for anything. I'm just saying I know some people have met some other very famous people and been very disappointed by what they smell.
Matthew McConaughey.
We're not going to talk
Doesn't
about
he
people.
bathe every 6 months?
We're not going to talk about the people that we know or have confirmed. We're only going to talk about hypotheticals. But I mean,
You used to be so bold, Twila.
well, somebody else used to pay for the lawsuits. Now I have to. No, I mean, but in reality, I mean, I think we've all heard about the idea of pheromones and things like that, and that there's certain smells that we like. But I mean, I'm 43, and I come from a long line of women, and that is one of the things that you get talked to about very, very, very early on is the idea of maintenance and care, and nobody wants to smell that, and you don't want to have anybody smell anything, and that's usually a lot of people in my family never even had the specific you start your period talk, but they had a very specific you need to practice very specific cleanliness talk. And to my understanding, there's been some version of product or service or method that you use for as long as, at least in my family, 3 generations back.
Yeah. And what did that include?
I mean, the oldest things I remember are, like the types of underwear that you wear so that you don't promote, sweating and moisture.
Yes.
So, it's like
Cotton.
It's cotton. You don't do lace. Rubber. You don't use lace. You don't use polyester. You don't use like the synthetic type, spandexy products. They're not really big on those. What actual material you use for your period to absorb period blood is huge.
Really?
That's a big deal because they, we came from a family that didn't really believe in using tampons.
Okay.
Because they thought that you were trapping things up there as opposed to holding back things. Yeah. And anything that promoted more odor or more mess was just like a no-go. You didn't do that. And it took until, I'm solidly of a generation that had to learn you don't use like baby powder and things like that down there. You're not supposed to be using talcum powder, but that was absolutely the norm for that was absolutely the norm for like my grandmother or my great grandmother to use, to keep you had your own personal thing of baby powder just like you had your own deodorant, your own. That's what that was for. Yeah. I mean, it was like these are people who by and large didn't always have money for things like the dentist, but they would drop dead before they let anything smell down there.
That is so true. Yes.
Well, I also want to just say that as a little bit of a teaser to listen to the rest of this podcast too, is that we're going to be talking about some of what causes this odor.
Yes.
Which is Dr. Klingman's kind of focus, because in terms of identifying the problem and also identifying a solution. So keep listening is what I'm saying.
Okay. I think they're in.
Okay.
At least I hope they are.
I hope so too.
So I'm sorry. Let's kind of jump back into the idea of historically there's some sort of precedent for why that it's not okay to smell bad, in particular there, but that there used to be a standard smell, and now we've taken that standard smell and turned it into a negative thing. Right. Do you think that that's more a construct of not necessarily a societal push, but where a lot of our societal changes come from, that it was an industry push? That an industry saw a hole in the market to sell their product or to push a product and they said, okay, well, if we say it smells bad, they'll buy it because they don't want to smell bad.
I think that's very true. And Dr. Klingman, and you were talking about Lysol.
Lysol.
Oh my God.
But I mean, believe it or not, when it first came out and they were touting it as a form of birth control, and it was about as effective as the withdrawal method, 50%. So women were douching with Lysol to prevent pregnancy,
which is a powerful. I don't know what is in Lysol, but it can't be good.
I think it's
not organic.
I mean, chemical burns. There were 8 reported deaths as a result of it. There were poisonings that came into play. 139 poisonings from 1889 to 1910. And so they said, hey, maybe we should dilute it out. So it wasn't quit using it. It was, keep on going, ladies. But what Lysol did so well is they put these ads out there where they showed actual pictures of men walking out the door carrying their briefcase, and it would say, was such a wonderful homemaker, an excellent cook, but she neglected one part that was so important for marital bliss, and that was her feminine hygiene. Keep your mimsy clean and don't smell like a kipper.
Wow.
Mimsy? I've never heard that.
I actually like that name.
I kind of do too.
It's kind of cute.
It sounds sort of
like it should be a pet,
gentle
like
aunt
a cat or a.
I would just like to point out yet again, every time we wind up doing a show where we talk about women historically and how their bodies are treated, I get an overwhelming urge to go find powerful men and kick them in the balls 12 times, because I get so angry at how these industries that we knew were not women. Didn't have women representative within the companies. We're making these massive sweeping decisions for women or to put neuroses in women's heads so that we buy product. And not only buy product, but buy something, put it inside our bodies. It's super dangerous.
And then the milder versions of douching came out, and we've all seen those. The not so fresh feeling that came out, years ago.
Mm-hmm.
But really, in the 70s, then douching became a big deal. Actually, douching's been around since the 40s, and it was in the 60s where the product called Vagisil then came out, and they decided, hey, we're going to call it. We're going to use the word vag, and we're going to empower women, call it what it is. This was an external product that they use. And not to say that Vagisil does not serve a purpose, but I think it's a symptom reliever. It has a numbing agent in it, so it's a lot like Ambisol when you put numbing gel on baby's gums. Yep. So it anesthetizes the vulva, and it's heavily fragranced. And so for any odor, they'll say they have some odor control, but it's so heavily fragranced. And I don't know, Eric, if you've seen patients in the office that have used Vagisil that have gotten burns or irritation from it, but it's a product that if you have a really itchy vulva from a yeast vaginitis or a vulvitis, it will relieve those symptoms, but it's not a long-term answer for women. If you're having to use a product to numb your vulva on a regular basis, you should probably see your gynecologist and make sure that you don't have something going on that we would recommend treatment for.
So, I'm sorry, go ahead.
Well, I was just going to say one thing I just appreciate Dr. Klingman saying that I wanted to just clarify is she used the word vulva.
Mm-hmm.
We're talking Vagisil, which obviously makes you think of the vagina, and vulva. And we're always very concerned about talking about correct anatomy here. And so just to clarify for people who don't know this, the vulva is external genitalia. The stuff on the tissue on the outside versus the vagina, which is, if you've listened to the gynocast, the fibromuscular tube that leads from the cervix to the outside. And so very
clear. And I say talk about that in my blogs, that there's been a story that's been told all these years that the vagina has odor, as if it's an inevitable part of being a woman.
Mm-hmm.
And the vagina is not to blame the vast majority of the time. And if you have odor in your vagina, that you need to have that checked out. And I'm not talking like, you notice like the biological smell of semen or blood or urine. That's not what I'm talking about. What I'm implying is that if you have a foul, fishy odor and it's so strong, it's stopping a clock for you, like you can't, you're preoccupied with it, you can't get on with your day, then you need to see your doctor, because there is a very high likelihood that you do have a condition going on. But there's also this huge subset of odor issues for women where they would, I would see patients in the office repeatedly coming in saying that they notice an odor. And it seems like the complaint of odor comes up, even if that's not the reason for their visit. I just noticed this odor from time to time. Or I have a new sexual partner and I'm afraid he gave me an infection because I'm noticing an odor that I didn't have before. Mm-hmm. And so you might notice that slight fishy off odor, but then, you do a speculum exam, you take a look at the discharge, you think about Amsel's criteria, the 4 things that we use to diagnose bacterial vaginosis, and we say 3 of the 4 have to be present in order to make the diagnosis. But if a patient's coming in complaining of odor, you're noticing a slight fishy odor, and now you're going to look at the pH of the vaginal discharge, for instance. If it's greater than 4.5, then that is a positive confirmed finding that falls in line with BV, or bacterial vaginosis. But let's just think about all the other bodily fluids that can impact that. Semen will raise it. Semen in the vagina, even up to 72 hours. Menstrual blood. Postmenopausal women, just physiologically normal is above 4.5. So all postmenopausal women are going to have a positive pH test for BV. And so these things, it just seems so imperfect. Then we look for a certain type of cell in the discharge, and we really need to be looking under the microscope. Doctors are busy. I think most of the time they fail to do it. And then if they do, you have that as a physician, we just so really are in it for the right reasons, want to remedy the concerns of our patients. And so when they're coming in complaining of odor, we're noticing a little bit of odor. The pH of the vaginal discharge is a little bit elevated. We're far more likely to just go ahead and give them an antibiotic that they may or may not need. And so there was a study that was done in 2006 called Throwing the Dice for Vaginal Complaints. And what that study demonstrated was that doctors overdiagnose bacterial vaginosis 61% of the time, and they overdiagnose yeast vaginitis 73% of the time, which means that if you're going into the doctor's office with a complaint of odor, chances are you're going to leave with a prescription you probably don't need the vast majority of the time. And so this really frustrated me. As a resident, I noticed it, and then in private practice, it's like I didn't have the courage sometimes to say to women, it's not you. I mean, it's not BV, it's just you. And so I thought, it's not you, it's chemistry.
Right.
There has got to be a better way. So I'll tell you, if you want to know the dirty story on how I found out that this is more likely an external process when you're ready.
Well, I just wanted to interject, which is that one of the things we talk about on the show quite a bit is the idea of knowing your own body.
Right.
We all have odor, aromas, if you want to put that.
Speak for yourself.
Well,
we all scratch and sniff. I always say, it's kind of like picking your nose. Nobody wants to be busted doing it, but we all do it.
Right. Exactly.
Yeah. We all scratch and sniff, right?
I did.
Yeah.
And so, and so the importance of getting to know what's normal for you, so that if you notice something abnormal, you can get in to see your provider and see if there's something to worry about. Now, I just want to go back. I don't mean to keep driving the horse in this direction, but the idea, we were talking about Lysol and then diluting Lysol and then Vagisil. What are some of the things that have kind of come after that in terms of feminine hygiene?
Well, I would say somewhere between Lysol and Vagisil, and Vagisil is the one that's been joked about in numerous movies. We need a price check on Vagisil,
Right.
And there have been so many stories that have been told, and it's a humiliating stories, quite honestly, anyway. But other products would be like, the intravaginal gels, the acid gels that would be diagnosed or would be prescribed for women. And now they've become over the counter. So again, they're touting a vaginal odor. Yep. And so when women notice an odor when they take their pants down, we'll assume that it's vaginal most of the time. And we think there's something wrong. So
there used to be an actual product that was like an actual insertable product, like a Massengill type product, where the difference at least for us, I was born in the 70s, so the difference for us is our mothers used to use like a Massengill, and we'd see the little squeeze container with the insertable tip that was kind of a long pointed tip.
Yes, and it was very frightening.
And it had perforated holes in the sides, and you were intended to put the solution in and insert it and squeeze and then withdraw it. And then by the time we got old enough to actually do stuff like that, then like Vagisil existed, and you weren't actually supposed to like insert something all the way up into your body. You were supposed to just wash your parts with it, but they weren't really clear about what that meant. So of course, we were all overdoing it because none of us wanted to smell funny.
Douching is still about a $20 million a year industry, though.
I was going to ask you it, because douching is not gone. Douching is still, and you walk down
for $1 right there. I mean, it's like a
that's like a third of a latte, and you feel that much better about yourself. And so you've got douches, which have been around forever, probably. You've got the Vagisil, you've got now body washes have come out where they'll say they're pH balanced. But if you look at the ingredients, they're really sodium lauryl sulfate. They're shampoo that are scented a little bit differently. They're put in a pink or a purple bottle. And again, there's no difference between these body washes that, Summer's Eve or Vagisil makes one. They're a pH balanced shampoo. Most shampoos are already pH balanced, so really there's nothing magical about it. And also, the other thing that I would say is you're only as clean as the moment you step out of the shower. Because once I discovered that this was an external reaction, I knew that I had some work to do to prove that was the case so that I was credible. And so we hired a lab in Los Angeles to do a study. And what I was suspecting was that external bacteria that are commonly found in our GI tract have this very similar chemical properties to the bacteria that become overgrown in the vagina during the processes of BV. And when those bacteria come into contact with bodily fluids like semen and blood, especially semen, but blood, and then also perspiration mixed with urine, there's these amino acids that when they get digested by these bacteria, it releases a gas called trimethylamine, which is indistinguishable from the trimethylamine that gets formed during the process of BV. So once we discovered that, I thought, okay, now I got to invent a product that women can use on the outside, because this is not a vaginal problem. This is not internal. This is an external chemical reaction. And even though it's normal and it's physiologic, every product on the market, when you look at the conga line of products, they are somehow implying that there's something wrong with you, that there's vaginal odor. And so men and women alike, men have the same thing. I hear from a lot of gay men that say the exact same thing, that nobody has ever identified it, nobody talks about it, but they feel like when I told the story of Lumi, or they'd get on our website or hear it from their friends, they'd say, man, this product works like a silver bullet. We eliminate that odor-causing reaction. I think it's empowering. Well, this is one of the more powerful things you're talking about, which is that most people, many physicians, in fact, as well, or practitioners, believe that this odor comes from the inside. And in fact, you're saying that it mostly is the outside.
It most commonly is. And I use the defense of when my husband and I were trying to have a baby, and we were trying to get pregnant a lot. He knocked me up like 4 times, like right in succession. Wow. So I know So he
sounds like Mr. Dang.
And there you go. It was only 3. Thank you very much.
That's some life force there.
Yeah. So we got busy, and as we were both busy practicing OBGYNs, and there were times when, it's like we would get together at night, and one of us was on call, me, and would get up in the middle of the night and then have to head to the office in the morning without a shower. And I remember going into one of the private bathrooms where I'm not in a public part. It's like one of the closet bathroom there, and pray. And I thought, dang, I have something going on. Do I have BV? I had the exact same thought because I noticed that off fishy odor and did some checking around. And I thought, this is all external. The vagina was not the problem. And so that's how it started for me, where I thought, not only now is it a theory, I know it's true in the study of one, which was me. Yeah. And then to be able to prove that in a lab, and then to read this study that came out in 2006 saying that doctors actually are overdiagnosing BV 61% of the time, I thought, I need to change the narrative on this. The narrative is that this is external odor that is common to all people, men and women, but the vagina serves as a reservoir for these bodily fluids like semen and blood. Women have babies. We leak urine when we cough, sneeze, and laugh. We exercise. We're leading full, rich lives. And we wear spandex, and that is not your friend.
Especially when you get older.
And tights. I mean, have you ever just like taken those down and you're like, ooh, man, okay. And I think even though it's normal, to Dr. Heegaard's point, it's normal.
Yeah.
I know that I wouldn't want anybody down there noticing it. And so if there was to be intimacy to be had at that moment, it would all be above the waist. You know what I'm saying?
Yeah. Well,
Emotional intimacy.
Well, I think that's.
Yes, exactly. Your body's not a wonder.
You may rub your nose against my nose.
You look very nice.
Yeah,
sitting at a 4-foot distance. Thank you.
And when women will say, like, I don't have a problem with odor down there, I would say, well, I want to say, yes, you're right. But this odor is universal to all humans. Let's think about the anatomy. We have the anus, where we have bowel movements.
Can we say that?
Yeah,
we have the vagina, and it's all
What's
really.
the planet? What's that planet way out there?
Uranus.
I was trying to get me to do
Uranus. I prefer perirectal. That's how I describe it. But
this sounds it's so much better, and you could say that over a latte.
Perirectal. I know. Yeah.
Yeah.
But I thought since I was here in the presence of
an actual grown-up.
Dr. Heegaard. Yeah.
I'm just saying that if you're sitting there with your double macchiato and you're not going to say, boy, my anus itches.
Well, not in Starbucks.
But if you say, boy, my perirectal area is uncomfortable, nobody's going to bat an eye. Right?
First they have to stop. And
now
think about what you're
I'm totally going to do that this weekend. I have meetings out like all weekend, and I'm going to slide that in a conversation just to see if I get anybody to look.
Yeah, make sure they're listening to you.
Yep, I can't wait.
And it is kind of funny how we how we talk about these different parts of the body, which we're all more comfortable with rectum than anus.
Yeah.
Well, just because it sounds different. It just doesn't. There are things we're just conditioned to think that just doesn't sound right. It just doesn't sound
rectum
right to
just
you.
sounds like it's just a little farther away. It's like an unpleasant but distant relative.
It's the difference between saying I dislike and I hate.
Yes,
that's pretty much
an
it.
unpleasant, well-meaning, distant relative.
No,
but they're like other things though. We're much more.
Anus is in your face.
That's
man.
true.
That's
That's
right in
true.
your face. You say anus, it's like
Okay.
you are
Okay.
bringing it.
You're
You are bringing it to the
embarrassed.
table.
You feel like you're naked.
Listen,
cheeks.
all I'm going to say is somebody's going to take that exact clip out of the show. You just literally say anus is right in your face. It's going to be like,
you are bringing it.
okay.
Put that on a T-shirt.
Okay. I'm not selling that T-shirt. There's the line.
But to your point about being comfortable, everybody's comfortable talking about bad breath and underarm odor.
Mm-hmm.
I think it's because our noses are so close. But if we had a longer nose or shorter torsos, we'd be like, we would recognize that as something, I think.
So if you were an Asian tapir, whatever
if
those
we
are,
had an anteater snout,
you'd be. I see where you're going.
Yeah.
I like it.
I have a
Don't
question,
stand
though.
in front of a fan because you'll, what I'm saying. The odor exists there. If it exists in your underarms, trust me, it's down there.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
Now, I have a question. You were talking about the study where there seems to be an overdiagnosis of BV.
Mm-hmm.
Do you think that part of that overdiagnosis is similar to how we see other studies that talk to how we over-medicate for pain and things like the idea of like a woman comes into an office and you may know 1,000% that it's just your body. It's fine. But the sense of sort of panic or embarrassment or shame that a woman may come into the office with, and it's just like, you just have to help me.
The desire to relieve
just like
discomfort or to remedy a problem. I would always say to my patients, like, my don't misdiagnosis here is this. I do not think this is what I'm most concerned about. I don't think it's that, because you're listening to what their concerns are and what their biggest fear is, and you want to reassure them. Yeah. When a woman comes in and has concerns about odor, you can have odor all day long and it may not bother you. But then if you get into a new relationship, or if you somehow are starting to notice it through your pants, and this is a very real thing that women experience and talk about. You are so desperate to remedy that for them that I think we're already halfway out the door in diagnosing a condition that we can treat. And physicians, up until now, with Lumi, there's nothing over the counter that you can really legitimately say, you know what? I know that you think that this might be BV because you've been diagnosed with it in the past, but it's not in this case. And so I'm going to recommend that you use this product, and it's an external product that you use. And if that controls your odor, then you're good to go. Because if you have a true vaginal process going on that's pathological,
it's not going to go away.
It's not going to go away.
So I want to say that we're going to have another podcast with Dr. Klingman where I really want to dive in to kind of the underlying physiology of the vagina, which, people spend a lot of time thinking about vaginas. I mean, whether you're male or female or heterosexual or homosexual, people think about vaginas.
They hear a lot about it.
They hear about it, and many people would like to spend a lot of time there if they could.
You're just dropping jewels that people are going to cut out of this podcast today.
Well, okay. Well, it's a dark and mysterious place, is what I guess.
It's a jungle down there, baby. You should read my blog. It's called "I Say It's a Jungle Down There." So welcome to the jungle. That's what.
So I want to talk. I want to tap into Dr. Klingman's understanding this a little bit more in more time. But I do also want to just let people know that we've been talking to Dr. Klingman. She has started this company called
Lumi.
Lumi.
And that's what
Lumi deodorant.
Yeah. So let's kind of go back. With your practice as a doctor, and you understood and you recognize that there is a need to change the narrative. I thought that was a really powerful thing that you said, changing the narrative of us thinking that there's something inherently wrong with us internally when really it's an external problem that can be addressed. How did you go from that sort of aha moment of I want to change the narrative to actually pushing yourself to develop a product? Because that's a leap a lot of medical professionals don't make.
Right. I think that when I initially started having this idea was when I was a resident, and I would bring it up to my supervising attending physicians, and it's like, listen, you got 40 more patients to see, just chop, move on. And so you would kind of empirically be treating women for BV, and then these lab tests didn't substantiate it. And I noticed that over and over. And I actually started to question my ability to accurately diagnose it, thinking, is it me? Am I not good at what I'm doing here?
Right.
Am I not able to deliver the message? Because when you tell a woman there's nothing wrong with her, but she has that concern, that's not what she wants to hear.
That's right.
And in practice is also a business, and there's that need to retain patients. And part of that is, like to your point, you're complaining of pain. This isn't whatever your pain point is. I can sit back and the bubble over my head is this is normal and to be expected. But if they're suffering with it, you so desperately want to relieve that because they're your patient. This is your This is your business. This is your family. Your network. And so I think that in defense of physicians, I understand that. But then when I had that personal experience and I went to my husband and I said, listen, this diagnosis of bacterial vaginosis is so imperfect, and I'm going to tell you how I know this. And he was like, that makes total sense.
Can I just stop you there for just a second? For people who are listening, and we've been throwing out the word BV, and many people know what that is, but I just want to clarify that BV stands for bacterial vaginosis. Mm-hmm. It's generally described as an overgrowth of bacteria in the vagina that can cause discharge and odor. Mm-hmm. And it's one of the more common reasons when somebody comes in to see us. It's one of the more common diagnoses
or
that we
complaints.
give them. Or complaints. So that's what Dr. Klingman is talking about here.
Yeah. So then when I discovered that this was external, I went right to the kitchen because I had a suspicion about how to improve it. And actually, the science that I used was from a condition called trimethylamminuria. It's a rare metabolic condition that's diagnosed in children where they lack an enzyme where they can break down the amino acid choline and carnitine. And so
do you want to kind of riff on that a little bit?
Yeah, because I can. Because
I know you've done a lot of.
Oh no, he can see on my face. I was already like, I'm going to have to write down the exact.
I will tell you.
The only reason I'm joking is, Twila, above my pay grade too.
Well, I'll tell you what it is.
My jaw's open.
I'll keep it very simple.
Yeah.
I'll dumb it down for you.
Please
Dr.
do.
Heegaard.
Please do.
Yeah,
it.
I'm okay with that.
So trimethylaminuria is a metabolic condition. It's called fishy odor syndrome. And because of an enzyme that they lack, certain amino acids do not get broken down and digested in the upper GI tract, and they make it into the lower GI tract. And as a result, carnitine and choline, the amino acid choline especially,
Which are proteins.
yes, yep, it's a part of a protein, gets broken down by these anaerobic bacteria, and a fishy...
Meaning bacteria that are not exposed to oxygen,
yep.
mostly in the colon.
Yep, and they're the stinky bacteria,
The
right?
stinky ones.
So they digest this amino acid choline, and it releases trimethylamine, which is exactly the gas that gets formed with bacterial vaginosis, which I'm also suspecting. Semen on the outside, rich in choline, blood has choline, gets digested by bacteria in our GI tract, and again, the trimethylamine is formed. And that's the same odor molecule of all of those conditions, and it's indistinguishable. So
how did you figure that out? Can I just ask? And where did that come from? Finding this.
It was literally like a hole in my heart that I had to fill. I was so bothered by this. I just remember talking to my colleagues about it and having them go, you got 40 patients to see.
Yeah,
Just
right.
keep going.
Keep going.
Yeah, just keep going. I mean, what's
Give
the big
some
deal?
antibiotics and let's
This
move
isn't, exactly. What's the big deal? But I think what I realized is that women there was a story that was being told about vaginal odor. And the male-dominated industry that was feminine hygiene, and that is feminine hygiene, was telling the story. There have been plenty of jokes that have been certainly made about feminine odor. And I thought, it's time to change the narrative, because this is a universal concern to all humans. Trimethylamine is a gas that gets formed. Men have the same thing.
Well, and men smell down there too.
Sure, they do, but women aren't making
Some
a
men.
case for it, right?
Well, it goes back to the same thing as always, which is we assign a different standard to the male smell than we do to the female smell. Like we assign, like virility and masculinity to like having any kind of a smell whatsoever. That's why even the celebrities that we know that we've heard through direct experience
will
don't
not
smell
be mentioned.
great. Yeah. Even though we know or we've been told they don't smell great, they still get a lot of attention. Can you even imagine for 5 seconds what that would do to a female celebrity's reputation?
Yeah, if Cameron Diaz walked into a room
and the understood was that she smells a little. She doesn't smell very nice.
She's got great
That would be
chops.
crazy.
She can just burn through those lines. But man,
right? But
I mean,
we've even set up we've set up a whole cottage industry now of that does what many cottage industries have been built around, making women feel bad about their own natural bodies and the state that they're in, and we've now monetized to a very large degree, making women feel bad about the way that we naturally
So whatever
smell.
happened to sweaty balls? So why
sweaty balls? I mean, we are.
balls.
I wrote a blog about sweaty balls, and there's a lot of hair, there's a lot of fluids and sweat, and men can benefit from this too. But I've actually been approached by people saying that this is a misogynist viewpoint that I have taken, that I'm somehow again continuing to propagate it, whereas I would say the counter is absolutely the case. Whether you have a vagina or not, if you have a rectum and you are exposed to bodily fluids, you will have these odors. Yeah. And the vagina is not to blame, nor does it have anything to do with it other than it may serve as a reservoir for fluids like semen and blood.
Well, wait, let's go back and dig into that just a little bit, because I'm fascinated by the idea that anybody would think that there's a misogynistic viewpoint behind a product like this. I'm assuming that thought process is the same as the thought process of you shouldn't shave your legs because, or you shouldn't wear makeup because.
Right.
And I think all of those go back to the same thing, that yes, there may have been a societal standard that was put in place that the other gender doesn't have to adhere to, but it's still, at the end of the day, it comes down to a choice.
Exactly, Twila.
I mean, that's what feminism is. Feminism is equality among men and women, and the ability to make your own individual choices without judgment.
Right.
So I may like to look like a hobo 6 days out of the week, and I could care less about putting on makeup. But if I want to shave my legs and my armpits, that's my decision. If I would like to use a product that lets me feel more confident about the way that I smell going out into the world every day, that's my decision. And I think that should really and truly be the only part of that matters.
Yeah, the pendulum did swing for a little bit into a little bit of shaming, like shaming the glamour, shaming women, even that wore makeup, like somehow we were falling in line with what the expectation was. But I think each woman needs to define for themselves what it is that empowers and makes them feel better about themselves. And that's the wonderful thing now is there's so many different things to choose from, right? It's okay. No matter what you do, it's always the right choice.
Right.
For you.
And there's a difference between using a product, say like a Lysol product that is physically dangerous for your body.
That's exactly what I was
there's a huge difference between using something that is actually unhealthy to put inside of your body and using something that is an external product that works in very much the same way as as we would use a deodorant product or as we would use our soap
because that to my mind is misogynistic when you are trying to promote something that is dangerous for a woman and not just we all like to get Twila, you've said I like to get gussied up. I think I've heard you say
like
that.
To look nice.
I like to gussy up a lot.
Yeah.
Well, I don't think
my husband and I have been married for 12 years, and I think,
You like to get gussied up.
I'll tell you, there's some girl math that goes on with intimacy. I don't know if how you feel about this, but I have some math that I do.
Okay, wait. Okay, this is really, okay.
So
this is good.
First of all, before we get into girl math, I want to mention this. So when we were doing see how it says for underarms and private parts? Mm-hmm. So, I mean, you can use this under your breasts, in your belly button. People who struggle with obesity, rapid weight loss, under tummy folds. This is underarms too. So it's total body odor.
I don't know. I'm waiting to see where you're going with this.
Okay, that's actually like a very specific
belly button?
No, that's a very specific thing that if you're a woman, particularly if you're a woman or if you're a plus size woman at all, there are very specific issues that you wind up having with certain parts of your body that other people don't have. I mean, I'm not necessarily, I'm probably somewhere on the low end of the spectrum of being plus size, but I've always had a large chest. And we've always had issues, particularly when I was pregnant, with like the under boob area, as it were.
Yeah, people get yeast infections.
If it can hold a pencil, chances are you have odor there.
Right, and that is a very, very specific.
That's my litmus
test.
I'm sorry.
That's a test you can take.
This is I'm giving the golden retriever.
You've never done the. Oh, well, never. You would never.
It doesn't need to be a number 2 pencil. You can take that quiz with any pencil.
Yeah,
if it can hold a pencil, you have odor there.
That is a fabulous comment because it's one of those things where I'm going to be thinking about this for the rest of the day.
Well, the whole
you'll be putting pencils everywhere. Dang, I never knew.
No pencil there.
Wow.
The pencil test was the test that we were told about when we got to
need a bra.
Yeah, well, when we got to the age of needing a bra, and now that we're older, it's now the standard bearer we use for whether we should get a lift or a reduction.
Or use Lumi.
Yeah, which is a lot cheaper than a reduction.
Exactly.
Yeah.
Exactly.
What do you mean? So if you can put a pencil underneath your breasts, you need a reduction?
Well, if you can put it in there and comfortably just walk around and it's not going anywhere, you might want to think. But I mean, if you're it's one of the factors that goes along with like other things. Like if you can put a pencil under there and pretty much go on about your day without a bra on and it wouldn't move, they might have traveled a little further south than you intended.
Yeah, I don't remember when I first heard that, but I remember throughout this process of developing and then launching this product that I thought the pencil test of, if your breast can hold a pencil, then you need a bra.
Yep, I heard that when I was 10 because that's when I got my first one.
If this can hold a pencil, that's where odor forms. So,
and but that was something that we were taught when we were kids too. That's how powder was supposed to go in your underwear, under your
the folds,
under your boob. Yeah,
all the creases and crevices. If you're human, you have them.
Yeah. And bacteria love moist, warm places.
Right, they do.
And other microorganisms as well.
So let's spin back a little bit because we were talking about sort of how you went from you had this moment. You realized you wanted to develop a product or you wanted to address this concern in some way. Yeah. How did you go from, I think I have an answer to this, because having an answer to something and going, hopping into sort of a very specific industry is a leap. How did you make the leap from, I think I know what this is, to I'm going to make something that's
courageous entrepreneur?
Yes. Well, first I got, so the idea came and we were able to solve the problem from our kitchen, like with some, mixing and some chemistry, but it wasn't well tolerated on the skin. Okay. So it was something that I knew I needed a chemical formulary for. So I hired somebody to help me to create a formula with the properties and the active ingredients that I had in mind. We got involved with different people along the way. I am telling you, this is not a straight line. I have been kicked, run over, backed over, punched in the gut numerous times. I have made so many bad decisions throughout this process of trusting the wrong people that I feel fortunate that I'm even sitting here today talking about the fact that we were able to launch this product. But that's what happened. We formulated it, and we were two separate products initially. It started off as a feminine hygiene, and then I used it on my underarms and realized that it worked really well. And I'm a varsity stinker. My armpits smell like, Dinty Moore beef stew about, 12 hours into the day if I don't have, I'm gamey.
Oh yeah.
Well,
the Outlanders. I was trying to do I'm gamey.
That's what Jamie Fraser would do. Have you ever seen those stallions where their noses go
and the steam?
But even the ability as a woman to sit here and say, you know what, I have a very specific odor. That is not something that we do normally. That isn't even. And you know me. I've been on this podcast with you, and we've been doing this together for a long time.
Yeah.
And you wouldn't have known that.
Well, that is a sort of leap from one comfort level to another. Very few women get to that comfort level where they're willing to talk about that really openly and be comfortable with it.
I think that my personality is one of full transparency, and what I have always thought is that it leaves me incredibly vulnerable because not everybody likes me. They'll say, I think you go way too far. I think you border on inappropriate. You're sharing TMI, too much information. But it's
You're
at the risk
for a podcast. You're like the perfect gynocast.
But I was just interviewed by a writer from the Huffington Post yesterday, and it'll come out either today or tomorrow. But one of the things that I said, one of the advice that I give people is be authentic, because whenever you try and be somebody you're not, excuse me, you miss out on the wonder of your core audience. Just remaining authentically true to who you are. And then also, because of my ability to really be, and some people would say foolish, but an ability to just talk openly about what my insecurities and experiences are as a woman, I get emails all the time from people saying, you said it out loud, so I didn't have to.
Well, that's what's so great about it. If you have the courage, if you want to say, or the comfort to talk about these things, or we all know, that you're not alone. And there's
right.
And if you're willing to talk about it, there's thousands of people who are not, who are concerned about it. And that's a big deal.
And I was raised by an RN. My mom is a labor and delivery nurse. And then being gynecologically trained, bodily functions below the waist are just like table talk for us, right? Dinner conversation.
Right, exactly. We could be eating ham sandwiches and getting exams.
Exactly. So I just had a high, keen awareness of my own body, and also I'm a problem solver by nature. Ever since I was a little girl, man, I was like trying to fix everything.
And a damn good surgeon.
Yes, I was fast.
Well, so if people want to get more information on Lumi, more information on you, where can they go? And also, let me just, before you say anything, is the website for Lumi, does it have information?
Tons of blogs.
Lots of blogs.
Lots of blogs that speak to this same thing. In fact, a lot of the topics we've talked about, I have a blog, if it can hold a pencil. I have a sweaty ball odor one. I have a...
Sounds pretty good.
I have, talk about Welcome to the Jungle, baby. So,
No, that's Saturday Night Live. That's
what I thought.
Right now, we're sold exclusively on our website, which is lumedeo.com, lumedeo.com.
Okay,
and we'll put a link.
L-U-M-E. We're going to put a link.
Yeah, absolutely.
L-U-M-E-D-O, like deodorant.
Yep, just D-E-O
dot
com.
Yep.
Or if you want to spell out deodorant, you can do that too, and you'll find us that way. But we've decided that it's easy. It's an easy word to misspell.
Yes, it is.
And so we've truncated that down. So
we'll put a link to everything. We'll have it up on the GynoCast Facebook page. We'll also have as a part of our syllabus that goes on our show page at Matriarch's website at matriarchdm.com. So
great.
Don't worry.
I'm not worried.
Did you read this? I just got to ask you. I can't remember if you read a little bit of this.
I didn't read it on the air. No. Would you
can
like me to?
You have to read that ad. That ad is incredible.
So good. And it's not good. It's just.
Now, you give us a little background. You said we referenced this a little bit earlier. How old is this ad?
Oh boy, I would be I know that Lysol started marketing and promoting women douche with Lysol somewhere around 1890, but I believe this ad came out around 1920.
Okay.
I don't know for sure. If you Google vintage ads on feminine hygiene, you'll see this one. It's a love quiz. We were loving to take quizzes even back then. Love quiz for married folks only.
Wow.
Why does he avoid her embrace? And it's a couple where he's looking away and she's looking very distressed.
Yes, indeed.
And the question is, because he is no longer happy in their marriage, constantly makes excuses to avoid the romantic intimacy of their honeymoon. That's the answer. Why does he avoid her embrace? Then another question. What has she done, and is it really her fault? It's not so much what she does as what she has neglected to do, and that is proper feminine hygiene. I love this one. Can neglect of proper feminine hygiene really spoil a happy marriage? And the answer is yes. And the pity of it is every wife can hold her lovable charm by simply using Lysol disinfectant as an effective douche. Question, can this purpose be accomplished by homemade douching solutions? Answer, no.
Of course not.
Salt, soda, and similar makeshifts do not have the proved germicidal and antiseptic properties of Lysol, which will not only destroy odor, but it is effective in the presence of organic matter. That must mean semen and blood. So at least they're thinking about it.
Yeah.
And then the last question, why does this husband not tell his wife why he avoids her? And the answer that Lysol came up with was because he feels that as a woman she should know these important facts and use every means in her power to remain glamorous, dainty, and lovely to love. He resents her neglect of such fundamentals as correct feminine hygiene, which is achieved so easily by regular douching with Lysol brand disinfectants. So, I mean, granted,
that was really written by a very passive-aggressive, angry dude.
Oh, my God. And when you think, I just also want to say, too, that it doesn't address the fact that he smells like a water buffalo.
Right. Nothing.
And it's god-awful. And, oh, my goodness. So, in any case, but just so we can kind of wrap this up a little bit, which is the American College of Obstetrician Gynecologists, their statement about douching is... Don't.
Okay.
Don't you douche.
That's not what they
Don't
say.
douche.
Don't. Which is because
it's like faux fur.
And we're going to talk a little bit about why you don't douche in the other podcast we're going to do with Dr. Klingman, which we are going to dive in to. We're going to plumb the depths, plumb the mysteries of the vagina with Dr. It sounds like a travel channel,
doesn't it?
Plumb the
which is
mysteries
the muscular
of
tube from the cervix to the vulva.
Exactly. But the point is, don't douche under unless you're a physician and you have a great reason to do so. It is it's not a healthy thing.
It's a self-cleaning oven.
That is exactly it. It's a self-cleaning organ.
All right, Twila, is there anything else we need to do right now?
Well, yeah, we should make sure we let everybody know that this will be a connected podcast, as it were. We're going to do an additional episode with Dr. Klingman. So you can just stay tuned and make sure that you're checking our website for more of that. In the meantime, go sign up at the Facebook page if you haven't already. That's right. GynoCast has a Facebook page.
It's a world of wonder.
It is. You go to Facebook, type in the GynoCast, and it will ask you to request to be a member. Remember, we have very specific conversations about sensitive topics, and we want to make sure that the audience that we have is a supportive and engaged one. So you ask us, we let you in, and then you get to be a part of the conversation.
And we check.
Yes, we do, and I have rejected some folks in the last couple of weeks, so don't think I don't do it.
Too, yeah.
I will bounce you.
Don't just try to sneak into the GynoCast.
You can't. You just can't get past the gate. So, right. And then we also have a Facebook page for Matriarch Digital Media. We are one of a network of podcasts, and you want to know more about what we're doing. So you should go to Matriarch Digital Media, like the page, or check out the website at matriarchdm.com. Thank you very much for listening.
Thank you. Thanks, Dr. Klingman.
Thank you for having me.
We'll talk to you soon.